guys, this is me Qualityoet and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about OET speaking, in which how to prepare OET speaking at home without any tutors and how to get B by self-preparation before exam. Okay, so let's move on to the tips. So everyone is having a problem of like fluency. Not everyone, most of the people are having the problem in their fluency and how to organize the topic and how the way I can introduce myself and how the way I have to improve my speaking and how I can involve the task while I'm talking to an examiner and how to wind up the session and which way I can ask the question which has to be relevant at the same time when I'm providing some educations and advice that has to be relevant to your topic. So these all are the confusion usually will be there when we start to do a self-preparation of OET speaking, isn't it? So here I have a few tips for you all. So these tips will surely will help you to tackle your OET speaking by self-preparation, and also it will helpful for you to score a B in your exam time. Okay, so first one is we can divide the OET speaking as 5 phases. Phase number 1 is call it as an introduction phase. Phase number 2 is collecting the history. Phase number 3 is providing education and advice after an assessment. And phase number 4, which is clarifying the doubts. And phase number 5, completing the task. So based on these 5 phases, we surely able to complete our OET speaking in a given period of time. Okay, so what is that introduction phase? What should I do? So in the introduction phase, only you are using your setting and nurse description. So basically we have 6 settings only in our OET speaking. One is hospital ward, second one community health center, third emergency department, 4 private clinic or GP clinic, and 5th school health clinic, and 6th one is home visit. So from the 6, any of the 2 topics only we will receive on the day of our examination. So in the introduction phase, we have to introduce yourself with the help of a setting. Before starting your 5 minutes of speaking, during our preparation itself, it is good to ask an examiner, how can I address you during our role play? Instead of after introducing yourself again and again asking the examiner's name, there we are wasting our time. So try to avoid that. So when your preparation time itself, you can ask the examiner, how can I address you during our role play? In case if they're not given a name of the patient or patient bystanders in our task, in our nurse description. So while you are introducing yourself, based on the setting, we are different way are going to introduce. How will you introduce if the hospital ward setting, which means hi, good morning. So this wishing the examiner or greeting the examiner is based on your time. At what time you are getting your speaking, either it could be a morning or it could be a noon time or it could be a evening time. So based on the timing of your examination, so please introduce yourself as per the timings. Okay, not all the speaking will not be good morning, good morning, good morning. Okay. So here you have to introduce yourself based on your timings as well as wishing your examiner based on the time and introducing yourself based on the setting. For example, hi, good morning. My name is Qualityoet and I am a registered nurse in this hospital ward. This is one way of introducing yourself, or else I am one of the registered nurses. So when you are using one of the, you must use the registered nurses, not I am one of the registered nurse. It is grammatically error. So if you feel that I may do a mistake, better you can introduce yourself. Hi, good morning. My name is Qualityoet and I am a registered nurse in this hospital ward. That's it. It is a simple way of introducing yourself without any grammar mistake. So if it is a hospital ward, how will you initiate your conversation? How are you feeling today? How do you do? How are you doing today? Or else you can ask like I have a good news for you that you are going to be discharged. In case if your patient is getting discharged, you are going to give a discharge advice. You can start like this. Hi, good morning. My name is so and so, and I'm a registered nurse in this hospital ward, and I'm your caretaker today. I have a good news for you. Would you like to hear about it? So like that we can start it. rather than starting all the time, how are you feeling today, how do you do, how are you feeling now, like that. So this is very different way of asking, or a different way of introducing yourself. Next phase, as I said, collecting the history. So how can I collect the history? For example, if it is a discharge advice, you can ask the patient, as you are getting discharged today, so do you have any concerns related with your health condition? If you have, please do not hesitate to ask me. I'm here to help you out. So when you are saying the questions like that, and the examiner automatically will reply to you. From there, you are just collecting the history, what exactly they want to know. Or else if it is a new patient admitted and you are going to clarifying their, like you have to clarify their doubts regarding the disease condition. So thereby, you need to collect few history from them. For example, if the patient is a smoker, how will you collect the history? How long have you been smoking? And how many cigarettes do you smoke in a day? And have you ever tried to quit your smoking habit? If you have tried, could you please share with me what type of method that you have followed to quit your smoking? If it is alcoholism, the same way. If it is a pain, you can ask, would you mind, can you please rate your pain on pain scale? And could you please share me about the quality of your pain? Either it's a sharp pain, or dull pain, ache pain, or radiating pain. So likewise, each like related with what we are collecting the history, that has to be kind of like asking question and getting the information from the patient. So this is the phase number 2. And phase number 3, after collecting the history, what you have done in the phase number 2, now you are providing an education or advice based on the answer, or based on the information which you have collected from the patient. So for example, if it is a smoking, what advice we can give? So we are giving multiple advice to the patient to give up the smoking. And if it is alcoholism, there are different methods of there to give up their alcoholism. If it is pain, analgesics, and then devotional therapy, and comfort methods, or conservative treatments for the pain management. So these are other things we can give. After giving advice and education, you are asking the patient, do you have any further clarifications? So now you are confirming, after you given the education, whether the patient has understood or not. So that you are confirming with the patient by asking the question. You are asking the patient, do you have any further questions? So here, patient is saying, yes, I have this doubt, I have that doubt, which means again you are giving an explanation. If the patient say, no sister, so far whatever you have explained to me, I have understood, and thank you for your explanations or advice, which means you can just now coming to the point of completing the task. So thank you for listening me, thank you for patient listening me, and thank you for accepting my advice. Then we can say that thank you for your cooperation. So cooperation and all, you can use it where the patient is not ready to accept your advice initially, later on they have said okay, which means there it is a cooperation. And then if it is patient is getting discharged and you are provided discharge advice, so that you are telling the patient, I wish you for a speedy recovery. So likewise, we can complete the task. So this is the way we have to prepare ourselves prior to the exam. So whatever the topics that you are getting it, that topic has to be divided with the 5 phases. Introduction phase. Before introduction phase itself, we must to ask the patient name. If they not given in our scenario, ask the examiner, how may I address you during our role play. And second thing is starting with an introduction. So to introducing to the examiner, you must know the setting. So either it is an inpatient or outpatient. If it is outpatient and all, which means community health center is outpatient, emergency department is an outpatient, school health clinic, and another thing is like private clinic or GP clinic, this and all outpatient department. So how will you introduce yourself? How can I address your problem today? May I know the reason for your visit today? And what seems to be the problem today? How can I help you today? So likewise, in a different way, you can introduce yourself and head with the topic. So thereby, in the introduction phase itself, you are introducing yourself and also you are heading with the topic. Then collecting the history. And then as per the history collection, you are providing advice and education. After giving education and advice, you are just clarifying either they have understood or not. There itself, you are providing the reassurance. And also you are providing the patients, empathy. Empathy you have to provide it. So these things will be made sure in that while you are providing education and advice after the clarification of their doubts. And then conclusion. So in between, you have to make sure for each explanations, whatever you have explained to the patient, that has been understood or not. So thereby they are asking, am I clear to you? Is that okay for you? Do you think you can do that? Have you understood whatever I have shared with you so far? Will you able to do it? Like that, after your each explanation, it is very important for us to give a reassurance words and make sure that what we have explained to them, it is understood or not. And also, if they have asked a question to you, we have to appreciate their each time whenever they are asking question to us. So you can say that I can really understand your concerns are really valuable, your concerns are really reasonable, I know how you must be feeling, but don't worry about it, I'm here to help you out. And then you can say, I'm really glad to explain about it, I could see some eagerness that you're showing on your treatment options. So likewise, we have to appreciate their each questions. So if you follow these kind of phase as well as the methods, which is really easy for us to tackle the score of B in our OET writing. Okay, I hope this video will be helpful for the students whomever is preparing for their exam and whomever wants to know about what is exactly OET speaking. And I'm not interested to get a tutors, but by seeing the videos I want to just improve my OET speaking at home itself, which means this video will be surely helpful for everyone. And whomever wants to join for class, our number has given in our description. You can contact us, and to know more about OET speaking, writing, listening and reading, you can contact us and join to our class. So